welcome to the heart dissection. I apologise for my voice, I've got a little bit of a cold. Okay, so here is our heart and our tools that we're going to use today, some scissors, forceps and a scalpel. So this heart is a sheep's heart, and we're going to start off by having a look at the outside structures, and then we're going to look at the inside or internal structures as well. So when this heart was in the body, it was positioned in this direction. So this side here is pointing slightly to the left of the animal, and this side here we can tell is the front by the big vein there, the fact it's pointing down, and also the back you can see is a bit flatter and smoother than the front. Okay. If you have a look at the very top structures, you can actually start to see some of those blood vessels. So here you can see that the blood vessels have been cut off, and this is actually the opening of the atrium, of the right atrium, which is returning the blood from the body. So attached to that would have been the superior and inferior vena cava, which return the blood from the body. And over this side, again, it's been cut open and there's a big blood clot in there as well. I'll just take that out. This side is also the left atrium, and in the back here you can see it has been sliced in the butchering process, but you can see this very thick walled blood vessel just on the top here, and that is the aorta that took the blood to the rest of the body. So we can start by having a look on the outside. There are capillaries. You can see the capillaries and blood vessels to the heart. So if one of those gets blocked, the cells around that capillary can't get the oxygen and can't get rid of their carbon dioxide, and they do start to die. Okay, but we're going to use those blood vessels as a guide today when we cut open the heart. So I'm just going to make a couple of incisions using the scalpel. I'm going to cut on the right hand side. You can see I just had to get started with the fat, and now I'll just push a little bit harder to get through. I'm actually trying to cut just beside the atrium wall, the atrioventricular wall, going beside one side of the heart to the other side of the heart. Just tease that open. And now you can see the right side of the heart fully open. I'll just put that scalpel safely out of my reach. Atrium at the top, ventricle at the bottom. You can see in here there is a blood clot, so I'll just try and remove that out. And you can see just underneath that blood clot are these little tendons. You can start to see them a little bit better now. These are sometimes called heartstrings, but they're really little tendons that hold the valve open. So if I put my finger in here, you can see that membrane of the valve, and they are anchored down by these tendons to the bottom of the heart. You can see that there is a hole in the middle, and when the heart opens and closes, that part, it pumps, it opens up to let the blood go from the atrium to the ventricle, and then closes to stop it flowing back the other way. Now if I just use my finger here, I can actually find the pulmonary artery. It runs at the back here and out . So the pulmonary artery always goes off from the vein. So there it is there. Okay, I'm going to open up the left side of the heart now. So again, I'm slicing just to the side of where the heart wall that separates the two ventricles are. And I'm trying to keep my fingers out of the way. And because this animal's dead, I'm not using too much care of what the organ looks like. If I was a heart surgeon, I'd have to be very careful at this point. I'm just going to cut down there. This heart's actually backwards. Whoops. Now how can I tell it's backwards? this side here is a lot thinner than this side here. That was going off to the aorta. That confused me because I knew that was the aorta and that's where the blood was flowing. But on this side, it goes up to the pulmonary vein, that side. You see my little finger poking out just up here? So it does come through. So this is actually the left-hand side, the right-hand side of the heart, not the left-hand side. I've actually cut through the back of the heart. I might see if I can turn it around in just a moment and take some other pictures. Again, you can see that valve, and there are blood clots in this heart. It's not perfect for doing a dissection. It makes it a bit hard to see, so I'll just try and get some of those blood clots out. Okay. Let's move those away. Okay, so what structures can you see? It is very glossy. You can see those valves, beautiful valves in there. This one has 1, 2, and 3 flaps, and you can see I've broken a couple of the tendons as I've gone. There's also this large tendon just here, if I just hold that one up, which tries to hold the pressure between both sides of the heart. You can see the same structures on the other side. Again, this heart has already been cut in half by the butchering process. Now, if I orientate this back around the other way again, so we can see the proper side of the heart, this side would have pointed. And this side points to the left-hand side of the body. There's that beautiful vein with the capillaries coming off the front. It's quite rounded now. The vessels were cut off the top. The atrium opening down into the ventricle on the right hand side. So you can see the right atrium is quite small. The blood goes into the right hand side and out through that pipe. Well, they've really cut lots of things off here. Right through the pipe, out through the pulmonary artery. It returns back through the pulmonary vein into the left ventricle up the top here, which again is being chopped off. That then opens up into the left atrium, into the left atrium, and off into the aorta. So if I just poke that finger back in, there you go, through the aorta. Okay, so there's the structure of the heart. So I'll just take a few photos of that, and we'll label that together.